Shalom Israel. Today is in the U.S. is September the 5th, 2021. It's time normally though for your daily COVID-19 analysis. It's also time for the weekly vaccine roll report. Hey, before we get started though, a big shout out to the 56 people. I'm sorry, 151 people who watched this video, Friday's video. That's an amazing number for me. I rarely get above 50. But you know what's interesting about this is, for the first time since I've been tracking both under and over 18 number, I've been having two videos, one for under 18, one for the over 18 crowd. This is the first time that the over 18 crowd has had more views than the under 18 crowd. So you have the under 18 crowd is 50, which is still a very good number for this channel, and you have the over 18 crowd who had 101 views. Of course, as we say here at Caribou Data Science Channel, 151 views should be equal 151 likes, okay, and 151 shares. All righty. So anyway, again, that's an amazing number for me. That just sort of validates the work the data I'm trying to share here, okay, and my simple approach to data analysis. All right. So anyways, let's go and take a look at your vaccine numbers. I think we're going to see here is that while Israel has a very aggressive vaccination program, over 60% of people fully vaccinated, you're still seeing cases increase. And I'll come back to that in a moment. Okay, so what you can see here, currently Israel has administered 14.1 million doses, 6.01 million have received one dose, and 5.5 million have been fully vaccinated. What's this look like for percentages? This means that 68% of your people have received one dose, and 62% of your people have received the full dosage. Okay? This is total cumulative deaths. You can see you had a flattening here. Now all of a sudden cases are spiking upward again. Why is that? Well, we know why. Because COVID-19 vaccine obviously doesn't keep people from getting cases. Okay? Yeah. But you still need to get vaccinated. And unfortunately, you probably got to get a booster shot at some point again in the next 6 months. Okay? Because there's no doubt in my mind, it is reducing the number of deaths, not eliminating deaths, but the deaths are climbing at a slower rate due to the vaccine. All right. But the point is here, don't be misled by all the talk about hospital beds and cases. Okay. If cases are going up, even with the vaccine, then hospital beds are going to go up. It's just common sense. So hospital beds is not really a good measure. Okay. Washington University's Health Institute for Health Metrics and Evaluations has a single best measure of a spread of a pandemic. It's daily deaths. Okay. But anyway, you can see at a flattening of the curve right here. Now, all of a sudden, it comes to cases, it's starting to climb. Oh, this is deaths. You got a flattening of the death curve here. Now it's starting to climb back up again. Okay. So let's take a look over here at the daily numbers in. Let's see exactly what we're talking about. So far, you have a total of 11.1 million cases, 7,154 deaths. Now you can see here, beginning increase in cases beginning in back here in the first week of July, and climbing all the way up to here. We had a single day spike of 16,629 cases. The next day that dropped back down to 7,993 cases. For the 7-day average ending September the 1st, you were averaging 9,594 cases per day. Now, what about deaths? Well, while we are seeing a spike in deaths, there's still, 60 at the most here, 55? Then it drops back down to 7, then it goes back up to 25. So I think in this case, a 7-day moving average is probably a better measure of the daily numbers. So for the 7-day period ending September the 1st, you were averaging 29 deaths per day. Now, weekly cases, look at this. So despite your aggressive vaccine program, your cases are continuing to climb. All right. What about deaths? Well, deaths are also climbing. Okay. Over 200 deaths last week, a single week alone. 200 deaths divided by 7 is what? Say 25 to 30 deaths per day on average last week. 25 to 30 deaths average. That's still not a bad number. But obviously, the vaccine. The best we can hope for is that these numbers are actually lower than they would be without the vaccine. That's the best thing we can hope for here. Okay. Now, what about monthly cases? You can see. Well, August was the second most month so far for cases. Okay. And September's deaths has already passed July's. September's cases has already passed July's cases. So this is increasing at a pretty high rate. What about deaths? Well, deaths you can see here are well. The good news is they're still lower than these four numbers right here. But again, this ended a 1, 2, 3, 4, 5, 6 month decline in COVID-19 deaths. But this is again only 500 deaths for the entire month. All right. So that takes care of your report for today, Sweden. Israel, thanks again so much for the 151 people who viewed this video on Friday. Thanks so much for those views. Of course, don't forget to click subscribe. Click on that like button. 151 views should equal 151 likes. Okay, that number is very important for YouTube. It's the views is how it gets YouTube's attention. So 151 views be a big step forward getting themselves noticed by YouTube. Of course, don't forget to click on that share button. Share the video on Facebook, on Twitter, and on emails and text messages also. Thanks again so much, Israel. We'll catch you tomorrow with an updated report.